Hi. So let's talk about other types of tissues and the membranes. So even though we're gonna have a respective lectures for the muscle tissue and the skeletal tissue, I just want to introduce this briefly. So the muscle tissue, part of the muscle. So there's a three types. So there's a skeletal muscle, muscle connected to the bone. That's why we call it skeletal muscle. Then there's a cardiac type of muscle that you can find it within the heart, and then there's a smooth muscle that you can find with the digestive system or within the blood vessel. They have their similarities and they have their differences, and that's as far as we're gonna go for now. So the skeletal type of muscle produces the movement within the muscle, so it moves the skeletal system, bone, because the muscles are connected from one segment to another. So I can flex and I can extend my segments. So, and I mentioned before, ligaments and the tendons. So the major difference between them is that the tendon connects a muscle to the bone, and the ligament connects bone to the bone. So the cardiac muscles produces the regular contraction, the heartbeats. So the smooth muscles found in the walls of the hollow organs, like the digestive organs or the blood vessels. So we will discuss the muscles in the muscle system later. Another type of tissue is the nervous tissue. So the nervous tissue is the most important one. It's part of the central nervous system, part of the peripheral nervous system, autonomic nervous system. We will spend a lot of time on the nervous system, but basically through the nervous system we send an electrical impulse. We send an electrical impulse from one place to another place, from the brain to the muscle. So the muscle can contract and can relax, so you can move the skeletal muscles. So you can pass electrical signal, so you can contract the heart. So you can pass the electrical signal, so you can work on the smooth muscles, contract blood vessels, dilate blood vessels. So here's the connective tissue membranes. So let's discuss membranes now. So the membrane is the sheet of the tissue. Pardon my Ukrainian, when I say sheet, I mean sheet, not the other one. So I'm sorry. So the function of the membrane is to cover surfaces, divides compartments, or separates external environment from internal environment, line the hollow organs of the body cavities, anchors organs, and the membranes are able to secrete a liquid or the lubricant to ease out the movement of the organs. So the one organ can slide kind of up against the other one. So there are two main categories of the membrane: epithelial membrane and the connective tissue membrane. Epithelial and the connective. So within the epithelial membrane, remember the epithelium is the outermost layer. We have a serous membrane, mucous membrane, and cutaneous membrane. So the cutaneous membrane would be your skin. Mucosal membrane, it would be membrane within the goblet cells that produce mucus, the lubricant, and can trap the bacteria as well. And the serous membrane is part of the serous tissue that contours the entire organ. So here's the lung that has a serous membrane that produces serous fluid. So, and we can find it with the pleura. Pleura is the lung. Cardium is the heart, pericardium, and the peritoneum with abdominal pelvic region. So the serous membrane produces serous fluid, and the serous fluid is the lubricant. So here's all this information in the table structure. So it's another type of connective tissue membrane. So you can look at that, but we call it fascia. So the fascia is like, for example, you have a coat, you have an outer layer, you have an inner layer, and then there's something in between. So that's the fascia. So it's basically separating one layer from another layer, or like compartmentalization. So the superficial fascia, areolar, adipose tissue, insulates the body, cushions the skin, supports the organ, holds them together. So let's say you have one type of tissue, another, and here's like kind of suspension lines. So here would be the fascia. So there's a superficial fascia, there's more the kind of outermost layer, and then there's like a deep fascia, like covers, separates, protects skeletal muscles, right? Compartmentalization, because let's say this group of muscles will contract separately from this group of muscles. We will discuss this in muscles. Also, you can find it with nerves and blood vessels. So it's just basically layers. So when you look at the tissue, at the organs, it's not just one solid structure. It's just layers upon the layers, have their particular structure that relates to their functionality. So then there's some other tissue membranes. Synovial membrane. So the synovial membrane, that's you find within the joints. Similar to serous membrane that you will find within the organs, soft organs. Then there's the meninges, the membranes that cover the brain and the spinal cord. We will discuss this in the nervous system. So, and with this I will conclude the membranes.